If you're over 60, there's one everyday habit that could be quietly pushing you toward a stroke while you sleep. No chest pain, no warning signs. You go to bed feeling perfectly fine, but by morning, your speech is slurred, your balance is gone, or one side of your body simply won't move. As a brain doctor, I've seen this devastating scenario play out far too often. And here's the shocker. It's not due to smoking, sugar, or a lack of exercise. No, it's something most people think is healthy. Vegetables. Yes, you heard that right. Vegetables. Every day, millions of seniors fill their plates with greens and veggies, thinking they're doing the best thing for their bodies. And many of them are. But a few specific vegetables, especially when eaten the wrong way or combined with certain foods, can quietly trigger blood pressure spikes, restrict blood flow, and even form clots that lead directly to a stroke. In this video, I'm going to reveal 5 common vegetables, probably sitting in your fridge right now, that could be putting your brain at serious risk without you even realizing it. So if you value your independence, your memory, and your ability to live life on your own terms, I urge you to watch until the end. What you learn here could save your life, or the life of someone you love. Before we dive in, if you haven't already, hit that subscribe button and turn on the bell. I post real, science-backed health advice made specifically for people like you. And if you find this video helpful, type 1 in the comments. If not, type 0 and let me know how I can improve. Let's begin with number 1, spinach. If you're over 60, you've probably been told 100 times, eat your greens, especially spinach. It's good for you. But what if I told you that this so-called superfood could actually push your brain toward a life-altering stroke without a single warning sign? As a neurologist, I've seen it happen more than once. A well-meaning habit quietly becomes the trigger for a silent disaster. The danger isn't in one bowl of salad or one smoothie. It's in the daily repetition, the green drinks, the raw spinach and salads, the powders added to water, all consumed in large amounts day after day. You see, spinach is loaded with oxalates, natural compounds that bind with calcium in your bloodstream. In young, healthy bodies, the kidneys flush most of it out. But in older adults, especially those with reduced kidney function or even mild dehydration, oxalate levels can silently rise. When oxalates bind with calcium, they form microscopic crystals, calcium oxalate, that lodge in the arteries. Over time, this hardens the arterial walls, narrows blood flow, and raises the risk of deadly blood clots. And yes, those clots can travel straight to your brain while you sleep. Let me share the story of Howard Ellis, a 77-year-old retired dentist from Pennsylvania, sharp, active, proud of his clean eating habits. For 2 years, he made the same green smoothie every night, raw spinach, banana, and almond milk. He thought he was feeding his brain. But one morning, his wife found him slumped over the kitchen table, unable to speak, his right side completely limp. Stroke. His labs revealed abnormal calcium levels, stiffened arteries, and kidney filtration that had quietly dipped below normal. No sugar overload, no smoking, no red meat, just the overuse of raw spinach combined with mild age-related kidney decline and chronic dehydration. A habit he believed was healthy nearly killed him. And here's the frightening part. No warning signs, no chest pain, no headaches, just a peaceful night's sleep, while a silent storm built in his bloodstream. Howard survived, but his speech and movement were never the same. Through tears, he told me, "Doc, I thought I was doing everything right." That's why I'm sounding the alarm today. Because not everything labeled healthy is safe for every age, especially when combined with medications like blood thinners, diuretics, or calcium supplements. Even something as innocent as spinach can quietly shift your blood chemistry and leave you vulnerable. So if raw spinach is part of your nightly routine, or you're blending it without talking to your doctor, please stop and reassess. It's not about fear. It's about eating the right foods the right way for your stage of life. And if spinach surprised you, wait until you hear what an ordinary cucumber might be doing to your blood pressure while you sleep. If you're still watching and you found this insight helpful, type 1 in the comments to let me know you're with me. Now let's move to number 2, cucumber, the safe veggie with a hidden risk. It sounds innocent enough, doesn't it? A few crisp slices of cucumber before bed? Refreshing, hydrating, low in calories. What could possibly go wrong? For years, cucumbers have been praised as one of the safest snacks for older adults, ideal for weight loss, blood sugar control, and staying hydrated. But what if I told you this cool, crunchy vegetable could quietly set off dangerous blood pressure swings in your sleep and even trigger stroke-causing blood clots? As a brain specialist, I've seen how small, well-intentioned habits can carry hidden risks, especially for seniors. And with cucumbers, the problem isn't in the vegetable itself. The danger lies in when and how you eat them, and how they affect your body's hydration, electrolyte balance, and blood pressure regulation while you sleep. You see, cucumbers are natural diuretics. They make you urinate more, flushing out fluids and sodium. That might be helpful during the day, but at night, especially for adults over 60 whose kidneys don't regulate fluids as well, that extra water loss can tip your body into mild dehydration while you sleep. And here's why that matters. As we age, our arteries stiffen, our nervous system slows down, our brains become more sensitive to even slight changes in blood pressure. Now, combine that with common medications like diuretics or beta blockers, and the result is dangerous. Your blood pressure may drop too low in the middle of the night, then suddenly spike in the early morning hours. This rapid swing is a recipe for disaster, opening the door to clot formation, vessel rupture, or mini strokes that damage the brain silently. Let me share the story of one patient, Mrs. Dolores Green, 81 years old, a retired school teacher from Ohio. She came to me after several episodes of early morning dizziness and blurred vision. She told me her bedtime routine was simple and healthy, a few cucumber slices and lemon water to stay alkaline. But when we ran her labs, her electrolyte levels were off, her kidneys were struggling to keep up, and her nighttime blood pressure dropped to alarming lows, followed by sharp spikes before sunrise. This rapid swing is a recipe for disaster, opening the door to clot formation, vessel rupture, or mini strokes that damage the brain silently. That's the kind of risk no one warns you about, because no one expects cucumbers to hurt them. But at our age, hydration is delicate. Electrolyte shifts are dangerous, and blood pressure is a fragile thread between safety and stroke. So next time you reach for cucumbers before bed, pause and think. They're not forbidden, but they are something to treat with caution, especially if you're on medications or managing chronic conditions. And speaking of hidden dangers, what if I told you one of the most trusted vegetables in America could be quietly interfering with your thyroid and cutting off blood flow to your brain at the same time? Let's talk about broccoli. 3. Broccoli, the brain food that could quietly disrupt your thyroid and starve your brain of oxygen. You've been told it your whole life. Eat your broccoli. It's good for your brain, your heart, your body. And it's true. Broccoli is rich in fiber, antioxidants, and essential nutrients that support health at any age. But here's what most older adults are never told. In certain situations, especially after 60, this healthy vegetable can quietly interfere with your thyroid and disrupt blood flow to your brain, and even contribute to the formation of blood clots that increase your risk of stroke. Here's why. Broccoli belongs to a group of vegetables called cruciferous, along with kale, cabbage, and Brussels sprouts. These vegetables, while nutritious, contain compounds known as goitrogens. In simple terms, goitrogens can interfere with your thyroid's ability to produce hormones, especially when eaten raw and frequently. Now, in younger adults, the body usually compensates, but after 60, your thyroid is already slowing down naturally. Add daily servings of raw broccoli to that, and you may quietly cross into dangerous territory without even knowing it. When thyroid hormone levels drop, your metabolism slows, your heart rate becomes irregular, and your blood pressure begins to swing. Circulation slows, blood thickens, and your brain? It starts getting less oxygen. That's the perfect storm for stroke.
Let me tell you about a patient, Mr. Arthur Blake, 79 years old, a retired engineer from Minnesota. A smart man who switched to a strict plant-based diet to stay sharp and healthy. He ate broccoli in every form, steamed, raw, blended into smoothies, sometimes twice a day. At first, he felt fine, but within months, he was experiencing unexplained fatigue, brain fog, and tingling in his left hand. His family thought it was just aging. Then one morning, while walking his dog, Arthur collapsed. It was a mild ischemic stroke. A small clot had lodged in a brain artery. His lab results told the full story: low thyroid hormones, a slowed heart rate, thickened blood. Years of over-consuming raw cruciferous vegetables, especially broccoli, had quietly suppressed his thyroid, disrupted his circulation, and starved his brain of oxygen. He survived, but now lives with partial weakness in his left arm and vision changes that may never fully heal. What scares me most is how easily it was missed. No warning signs, no high cholesterol, no chest pain. Just a man trying to eat clean, while his healthy habit slowly altered his blood chemistry and left his brain vulnerable. So let me be clear, broccoli is not the enemy. It can be a valuable part of your diet. But if you're over 60, it should be eaten cooked, not raw, and not in excess, especially if you have a history of thyroid issues, low blood pressure, or take medications that affect blood flow. Because your brain doesn't need surprises, it needs stability. And if you thought broccoli was a hidden threat, wait until you hear about a common kitchen ingredient, celebrated for heart health, that can thin your blood so much that a tiny vessel in your brain might burst. Let's talk about garlic. If you're still watching and finding this helpful, please type 1 in the comments so I know you're here. Now let's move on to point number 4. Garlic, the natural blood center that could thin your blood to the point of a brain bleed. 4. Garlic, the natural cure that could thin your blood to the point of a brain bleed. Most older adults believe garlic is one of the healthiest foods they can eat, and for good reason. It's natural, it's been used for centuries, and it's known to lower cholesterol, boost circulation, and even fight infections. And yes, garlic can be powerful, but that power cuts both ways. For seniors, especially those already taking blood pressure medications, blood thinners, or heart drugs, garlic can quietly become too powerful. It can thin your blood so much that a single tiny vessel in your brain ruptures while you sleep, with no warning and no pain. Here's the real danger. Garlic contains a compound called allicin, which reduces platelet aggregation, meaning your blood has a harder time clotting. In moderation, that might be helpful, but when combined with medications like aspirin, Plavix, or warfarin, garlic can amplify their effects, sometimes to dangerous extremes. Your blood becomes too thin, and when your body needs to clot, it simply can't. This isn't a theory. I've seen it happen. Take the case of Mrs. Joan Whitmore, age 84, a retired piano teacher from Oregon. She was taking warfarin for atrial fibrillation under careful supervision, but then she started eating 2 raw garlic cloves every night, something she read in a magazine that promised to reverse aging. At first, she felt great, more energy, clearer skin. Then came the headaches, the nausea, the confusion, and then, one evening while brushing her hair, Joan collapsed. It was a hemorrhagic stroke, bleeding inside her brain. No trauma, no fall, just one fragile blood vessel that couldn't seal itself because her blood was too thin. Her INR levels, used to measure blood thinness, had spiked into the danger zone.
not because her doctor made a mistake, not because she missed a dose, but because raw garlic had quietly intensified her medication beyond safe limits. Joan survived, but now uses a walker, attends daily speech therapy, and requires full-time care. And the most heartbreaking part is she thought she was doing everything right. She told me with tears in her eyes, "I never thought garlic could hurt me. It's food, not a drug." But here's the truth. When you are over 60, food can act like medicine or poison, depending on what else is happening in your body. Garlic isn't bad. In fact, it has real health benefits, but at this age, context matters, especially if you're taking medications that affect your heart, blood pressure, or clotting. A little raw garlic now and then, likely fine, but daily high doses, especially alongside prescription drugs, that's not natural, that's dangerous. And here's the cruel irony. While garlic can make your blood too thin to clot, there's another vegetable, celebrated for its antioxidants, that can do the exact opposite. It can raise your blood pressure, constrict your vessels, and quietly set the stage for a stroke-causing clot. Let's talk about eggplant. If you're still here and finding this valuable, type 1 in the comments to let me know you're watching. Now, on to number 5, eggplant, the forgotten vegetable that could quietly tighten your arteries and trigger a stroke without warning. Eggplant seems harmless, maybe even healthy. It's a staple in many heart-friendly recipes, low in calories, rich in fiber, packed with antioxidants. It's even praised as a brain food thanks to a compound called nasunin, known to protect brain cells from oxidative stress. But here's what most seniors never hear. Eggplant also contains solanine, a naturally occurring toxin in nightshade vegetables. In small amounts, healthy younger adults can tolerate it. But for people over 60, especially those with poor circulation, inflammation, or neurological vulnerabilities, solanine can become dangerous. Here's how. Solanine can cause vasoconstriction, a tightening of blood vessels. That might not matter when you're 30, but in an aging body, it can reduce blood flow to critical areas of the brain. And when circulation slows, the risk of blood clots rises, especially at night when blood pressure tends to fluctuate. I'll never forget a patient named Mr. Franklin Monroe, 82 years old, a retired railroad mechanic from Kentucky. Strong, independent, loved cooking his own meals. One of his favorites? Eggplant parmesan. He made it twice a week, every week. But gradually, he began noticing symptoms, frequent headaches, cold hands, and a strange heaviness in his chest when climbing stairs. His primary care doctor dismissed it as aging, but then one morning, Franklin collapsed in his driveway. It was an ischemic stroke. A clot had blocked blood flow to the left side of his brain. There was no history of smoking, no high cholesterol, but his lab results told the story. Vascular inflammation, poor circulation, and markers of solanine sensitivity. That seemingly harmless vegetable had been quietly narrowing his arteries until one clot struck. Franklin now uses a wheelchair. His mind is sharp, but his body is slower. And what he told me still stays with me. "Doc, I thought I was eating smart. I didn't know I was slowly cutting off my own blood supply." That's the lesson here. It's not about what's generally healthy. It's about what's healthy for you, at your age, with your unique history. Eggplant isn't poison, but in large amounts and in the aging body, it can become a hidden threat. So now that we've explored 5 healthy vegetables that may actually harm the aging brain, the question becomes, what should you be eating to protect your memory, clarity, and independence? 6. So what should you eat? The real foods that truly nourish the aging brain. After learning how everyday foods like spinach, cucumbers, garlic, broccoli, and eggplant can raise your stroke risk, many seniors are left wondering, what's even safe to eat anymore? It's a valid question, and the answer isn't in trendy superfoods or supplements. It's in something far simpler. Your brain needs real, whole foods, balanced, natural, eaten at the right times for your body. Let me introduce you to Mrs. Margaret Wilson, 73 years old, a retired school principal from Arizona. She came into my clinic frustrated and tired, carrying a drawer full of supplements. She said, "I'm trying everything: vitamin D for my bones, E for circulation, a brain-boosting smoothie every night, loaded with spinach, garlic, and eggplant."
And yet, she felt worse. Dizzy in the mornings, her memory slipping, her blood pressure spiking overnight. Why? Because despite her good intentions, her healthy routine was flooding her aging body with compounds it couldn't handle. Too much of the wrong nutrients, not enough hydration, no balance with her medications. The result? Subtle blood chemistry imbalances, leading to clot risk, brain fog, and silent damage to her independence. So we simplified. No more powders, no more mystery blends, just real food built for the aging brain. A boiled egg and half an avocado, clean protein and healthy fats. A slice of whole grain toast for slow, steady energy. A handful of blueberries, packed with polyphenols that ease brain inflammation. A glass of room temperature water to gently rehydrate the brain after sleep. Occasionally, we added walnuts or a small serving of salmon for omega-3s. That was it. No extremes, just nourishment. Within weeks, Margaret's dizziness faded. Her memory came back into focus. Her blood pressure stabilized. She told me, "I feel like I'm finally feeding my brain." And she was. Because real food doesn't just fill you, it heals you. It doesn't spike your sugar, crash your pressure, or clash with your medications. It supports every neuron, every vessel, every heartbeat. But even these healing foods must be used wisely. Timing, hydration, and medication interactions still matter. What helps one person could harm another if the body is inflamed, dehydrated, or under stress. The final truth? It's not about food. It's about awareness. If you've made it this far, it means you care. Not just about living longer, but about living well. So here's the most important thing I've learned in decades of treating aging brains. It's not the food you eat, the pills you take, or the exercises you do that protect you the most. It's your awareness. At 60, 70, 80, your body changes. Your liver processes slower. Your kidneys filter differently. Your brain becomes more sensitive to even slight shifts in hydration, blood pressure, and nutrition. That's not weakness, it's biology. What becomes dangerous is when we ignore that biology and keep living like we're still young. Most of the strokes I've treated in older adults didn't come from smoking or junk food or laziness. They came from good people doing healthy things without realizing those habits were silently altering their blood chemistry. The spinach smoothie, the bedtime cucumber, the garlic clove on blood thinners, the raw broccoli, the nightly eggplant dinner. Innocent, well-meaning, but sometimes enough to tip a fragile system into chaos. And the consequences? They're not just physical. They steal speech, memory, mobility, independence. So here is my heartfelt plea. Slow down, ask questions, read every label. Listen to your body when it whispers, not just when it screams. Talk to your doctor before adding anything, even a vegetable, to your daily routine. Because sometimes the smallest changes lead to the biggest outcomes. You are not powerless. You are wiser now than ever. And your awareness, your willingness to learn and adapt is the most powerful medicine you have. Stay curious, stay cautious, stay alive. Your brain deserves it. You deserve it. If this message resonated with you, I invite you to comment 1 below. If it didn't quite land, type 0 and let me know how I can do better. And if you believe someone else needs to hear this, share it. Subscribe to this channel for more life-saving insights tailored to you. Thank you for watching. Here's to living life on your terms, smarter, stronger,
and fully aware.